Chapter 5 is all about emergency situations and emergency care. No matter the setting, some sort of emergency may happen, and we need to be prepared in order to treat this situation. Emergency situations that occur to athletes at the workplace can include life-threatening or limb-threatening situations. Although we may rarely experience these situations, we still are obligated to provide the correct emergency care if one of these situations does arise. As part of this section, we will look at the Emergency Action Plan, or EAP, as well as the primary survey. An EAP is very crucial to have at any organization and is part of the organization's policies and procedures. The EAP includes written procedures that designate actions to help you and other employees respond to emergency situations. The EAP is communicated to all personnel on a regular basis, typically yearly, and it includes first responder and other personnel roles, activation of the Emergency Medical Services or EMS system, availability of emergency equipment, and athlete care. Importantly, the EAP designates what the first responder is to do during a situation. The first responder provides immediate care to the injured athlete. A first responder in any situation is the first person on the scene of an emergency. The first responder also commands the scene and gives direction to other employees who can help. Other personnel at the scene are to assist the first responder in all situations. When we look at somebody that is a first responder, activation of the EMS system will begin with that person. If the first responder instructs another employee or bystander to call 911, this is the initial activation of the EMS system. The EAP in this situation designates the imperative information that the caller gives to the dispatcher if EMS is activated. This information typically includes the type of emergency, the number of injured athletes, the extent of the injuries, and the care that is currently being provided. Emergency equipment used to care for the injured athletes in emergency should always be on site or easily accessible. Emergency equipment at your facility may include vacuum splints, crutches, wheelchairs, an AED, and other splinting materials. In the EAP, it should be instructed on how to use this equipment properly. Athlete care is the last part to the EAP. Our goal is to provide the athlete with the best possible care and chance for survival in these emergency situations. Typically, the first responder provides the commands unless another person is present with more experience or holds higher credentials. Then that person will then be the primary care provider. During emergency situations, we always have to complete a primary survey. A primary survey is performed to determine if our athlete or individual is experiencing a life-threatening injury or illness that warrants emergency care or activation of the Emergency Action Plan. To begin the survey, we first have to determine if the athlete is unconscious. Unconsciousness can be caused by a variety of injuries and illnesses, including head injuries, shock, cardiac arrest, and heat stroke. We have to make sure that we have to determine if the athlete is breathing or not breathing in this unresponsive state. Two stimuli in order to determine if the athlete is conscious or not conscious is voice and touch. As we complete our primary survey, we can go up and ask the person, "Are you okay? Are you okay?" As we are asking them this, we can gently tap the shoulder to see if that person responds. We should always suspect that an athlete has sustained a spinal cord injury, especially if they are unconscious, if the following occurs. If they fall from a significant height, if they have a traumatic accident, such as a car accident, they have sustained a direct blow to the head, or is motionless lying on the ground and you did not see them go unconscious at that time. Regardless of whether the athlete has a spinal injury or not, once you determine the level of consciousness, you need to immediately send someone to phone 911. In this situation, we also should stabilize the head, neck, and spine in the position that we find the athlete or individual until advanced medical care arrives. If no one is around to call for you, we need to position the athlete in the modified Haynes position. More on this in a second. If we are stabilizing the head, neck, and spine in the position that we find them, we need to make sure that that head, neck, or spine does not move. If we move the head, neck, or spine, or it is moved by some other means, we may produce further injury to the athlete. If we are by ourselves and we have no one to call EMS, we can put the athlete in the modified Haynes position, call 911, then return to the athlete and continue our care. Haynes stands for high arm and endangered spine. The purpose of this position is to attempt to maintain an open airway while you call 911. After we return the care to, or after we call 911 and we return to the athlete and continue care, we have to check and see if the athlete is breathing. Check out this video to see how to put an athlete or an individual in the recovery position or modified Haynes position for a suspected spinal injury. The next step of the primary survey is check for breathing. After you have determined the athlete's level of consciousness, we need to check to see if the athlete is breathing. If the athlete is face down, we can tilt our head to the side and put our face by the nose and mouth to see if you can hear or feel breaths. If possible, we can also look at the chest to see if the chest is rising and falling with each breath. We can also put our hand gently on their back if they are face down to see if we can feel the thorax expanding. If we cannot tell if the athlete is breathing or not breathing, then we must log roll the athlete onto their back. Check out this video on this slide to see how to log roll an athlete correctly. When we do log roll an athlete, we need to make sure that the athlete's head, neck, and spine move as a unit so we can protect the spine at all times. If the athlete is face up, we can monitor an athlete's breathing by staying close to his or her mouth and nose. We can listen and feel for breaths while looking at his or her chest to see if it's rising and falling. If we are the ones stabilizing the head, neck, and spine in the situation, we should have another helper or assistant check breathing so that we do not remove our hands from the unconscious athlete's head and neck, because movement then can occur and further injury can happen. The next part of the primary survey is to check for severe bleeding. And I say the next part, however, as we check for breathing and unconsciousness, we should also be checking for severe bleeding at the same time. We must check the athlete from head to toe to see if he or she is bleeding severely. While we are checking the athlete's breathing, we need to see if there's any blood around the body as well, on their clothes or on the surrounding ground. If we are the only one attending to the patient or athlete, then our priority is to make sure that we check for breathing and determine whether your athlete needs CPR or not. CPR, or cardiopulmonary resuscitation, occurs when the athlete is not breathing. If the athlete is not breathing, we need to begin CPR immediately. This could potentially save the life of an athlete who is experiencing cardiac arrest. By using our CPR skills on the athlete in cardiac arrest, we can manually force the heart to pump oxygenated blood to the brain and other vital organs in the area. The proper CPR technique is to give 2 rescue breaths, compress the chest 30 times at a rate of 100 compressions per minute at the mid-sternum. At this point, this helps compress the heart between the sternum and the vertebrae to send that circulated, oxygenated blood to the brain and vital organs. There has also been a new hand-only CPR technique. With the new hand-only CPR technique, we use our hands to administer chest compressions, but we do not give mouth-to-mouth or rescue breaths. In this situation, you are to give hard and fast chest compressions. Similar to full CPR, our hands are going to force the heart to mechanically pump blood throughout the body. Regardless of whether we're using full CPR or hand-only CPR, we need to continue administering CPR. We can see here the different area or different things that we need to have when using CPR. We can see a breathing barrier in the first picture, a separate type of breathing barrier in the middle picture, and then an individual completing chest compressions on an unconscious victim. We need to continue providing CPR until one of the following occurs. The athlete begins to breathe. You are too tired to continue. Advanced medical personnel arrives and takes over care. An AED is brought to the scene, in which you place the AED and it is used to analyze the body. Another person takes over for you, such as in 2-person CPR, or the scene becomes unsafe for you to continue CPR. Let's look a little bit about automated external defibrillator, or an AED. An AED is a machine that delivers electrical shocks to an athlete who has experienced cardiac arrest involving ventricular tachycardia or ventricular fibrillation. When we look at these 2 different situations, an individual can have a heart attack that can result in cardiac arrest. This typically occurs from these 2 things: ventricular tachycardia and ventricular fibrillation. An AED is going to deliver shocks to this individual who has experienced cardiac arrest involving these 2 situations. The AED's purpose is to briefly stop the heart in order for it to reset itself and then beat normally. These are really important to use in emergency situations because it has been shown that for every minute defibrillation by an AED is delayed after an athlete sustains cardiac arrest, the chance of survival decreases by 7 to 10%. Lastly, let's look at the primary survey when there is athletic equipment involved. When athletic equipment is involved in life-threatening situations, a primary survey still needs to be performed, regardless of whether equipment is worn or not worn. If the athlete is wearing equipment and you find that the athlete is not breathing, we need to make sure that we remove any equipment. Oftentimes, shoulder pads can obstruct our methods of delivering CPR and use of an AED. Therefore, shoulder pads should be removed from the individual. However, helmets, as the book states, should not be removed. In my experience and my knowledge in athletic situations, if we remove the shoulder pads, the helmet should also be removed. In this situation, if the helmet is not removed with the shoulder pads, this produces an increased flexion of the spine at the cervical spine and could move the spine out of alignment. Therefore, if shoulder pads are removed in order to complete CPR and use of an AED, the helmet should also be removed. However, this should only be completed if you are trained to do so. If you cannot get the shoulder pads off, or you feel uncomfortable taking the shoulder pads off, we need to at least remove the face mask immediately. Removing the face mask allows us to quickly and safely minimize movement of the head or cervical spine, but also allow us to provide air to the athlete if the athlete is not breathing. At all times, when an athlete is wearing equipment and when we are completing a primary survey, we need to stabilize the athlete's head and spine. In this video, you will see how to properly remove athletic equipment. Typically, when we look at athletic equipment, we use football equipment as the primary example. In this situation, you will see the individuals remove shoulder pads and helmet, as well as properly spine board the individual in this emergency situation.